Yo, hello. How you doing? Freddie, how
How
you
you
doing?
doing?
How you doing? Hey guys, listen. Big day on Chiro Mafia today. Big day. We had Danny Sullivan. We had to bring some of the, fill the quota, some non-Italians on there. But today,
It's
finally,
sparse.
oh, I feel better now. I feel better. We got a true paisano. How you doing? Listen, this is a guy that I've known for many years. Somebody to really have a lot of respect for. Somebody who's done a tremendous amount, continues to do for the profession on really many levels. Still practices as a chiropractor. He does articles. We're going to talk about that as well. Case reports, case reviews. He serves as a member of the Chiropractic or New York State Chiropractic Council. He's been part of Chiropassion. He's just a wonderful guy, public speaker, and somebody that really he puts out a lot of content on social media as well. But somebody that you really want to know. He's really a fellow soldier, a friend, a colleague, and somebody I care for dearly. And that's Dr. Otto Janke. Hey, brother.
Hey, that's quite a resume, man. I
Is.
feel lazy now.
Yeah.
No.
Hey, Otto.
Grazie mille, signore.
Grazie mille.
Si, si.
You were going to say something. What were you going to tell us? You were just about to say something.
A funny Joe story.
The funniest time you and I, Joe, had was on your back porch in Italy. And we had the driver, we could barely get down your driveway.
Mimi.
And it was one of the scariest times I've ever been to. And, and you and I are on that back porch with everybody else. And what'd you call your road?
I don't remember. It was bad.
You called your road like La Bella Strada.
Yeah, I don't know. I don't remember.
That. You and I just started crying for 20 minutes. So we couldn't answer anybody's other questions because we're like, we just took our lives like 100 yards over there. and the worst part was you didn't have enough of wine because we know we had to go back up that road to get back.
We had to go back up. I will tell you two funny things. One is I will tell people when you're coming down driving, I go, look, I'm just telling you it's really bad because it gets washed out every year. I go, listen, it's really bad. And when you think you're at your worst and you're like, holy shit, it hasn't even begun yet. No. That's the truth. That's the freaking truth. Here's the other truth, though. I will tell you the other truth is it's all cemented. I cemented it last year. So I've got a whole, it's about I don't know what it is, quarter mile or more concrete driveway. It's perfectly smooth now. It's all over. So,
well, you said before we got there, you said, "Oh no, I got to repair it. It's going to be great for you guys. Great for you guys." Then our driver gets out and he does one of these, and he's out there. We said, "What'd you do?" I put the brakes on in the back and I cranked it and pulled it to the left. I feel pretty secure about this.
Mimi. Yeah, because they drink over there. It's kind of crazy, but
I feel good about this.
So Otto, listen, great to have you on. I know you wanted to share something, so we could jump into that in a minute, but let's talk about this. Where do you practice? You're a chiropractor, still practice. Where are you?
Quick 31 and a half years in practice, Cortland, New York, the metro area of Cortland, New York, as we call it, Titletown. Having the Division III championships here, football.
Yeah. Fantastic.
Oh, super. And then our girls high school basketball team is going to play for the section championship tomorrow, Friday night. Yeah, so things are looking up okay.
I feel better about it. Go ahead, Fred. Were you saying something?
No, I was going to say that's big time in a small town.
It is.
Oh, we love it. It's crazy. We absolutely love it. Tremendous.
So you've been
in practice. Yep.
Yeah, and then you're with council, and you wrote a book as well. What was your
You Were Born to Be Healthy? I wrote that. My mom and dad both died in 2005, 5 months apart. And my mom said to me 6 words that have been tattooed in my heart and burned inside my brain, which is that without your health, you have nothing. And it took me a while to go through that stages of grieving, a quick 10 years. And in 2013, I wrote that first book, and I'm ready for my next book. But that was just a step to show people that health is very attainable. And
Yeah.
the basis for me for all health, I've been talking about this for probably 20 years in my practice. The basis of it all, I recommend that you eat great. I recommend that you eat just super, super healthy stuff. I recommend that you have motion every single day. I recommend you have mental rest and focus. But the foundation for all that is and has always been a nervous system that's optimized. Not good,
Yeah.
not okay, that's optimized. Because Joe, as you and I have talked about many, many times, and I still talk about this, that you can jam a bunch of organic carrots down a dead guy's throat and they don't do a damn thing.
Right.
You start off with an optimized nervous system. So we test that nervous system in my practice. Every new patient gets tested. They get tested on a regular, they get a recheck on a regular basis. I want you to feel great. I want you to be optimized as much as possible, though.
Yeah, that's awesome.
Well, you know, and that's when you look at people that see volume at bigger practices and have great retention. It's very simple. Lifestyle is very simple. You're either subluxated or you're not. The
Right.
problem is when people put gray in it, man. It's black or white. You're either subluxated, you're either 100% or you're not. You know, and when 98 is unacceptable is when you'll have a big practice, you'll have families, and you'll affect generations.
Yeah. Yeah.
You know, one of the articles I wrote years ago was all of us should have our funerals in stadiums. And it's for all the people we never have met in our lives, the generations of people in front of us that are decades after we die. Those people who, the grandchildren of the grandparents you see in your practice, and they come and thank you for allowing grandma and grandpa to be so healthy that they could enjoy more in their lives. And you start thinking about that, man, we got a bigger job to do.
Yeah. Yeah, for sure. We have a much
Absolutely.
bigger
Well,
job.
that's, you know, one of the things that we talk about, man. When your purpose is to build a legacy, not to build a practice. You know, when
Right.
you look at every patient that walks in and you think, well, the kids born 30 years from today have chiropractic as their primary health care because of the person I'm creating right in front of me now.
Right. Right. Yep.
And
And there,
that's, you don't need, I mean, social media is great, but you don't need ads for new patients.
Right.
nope.
Right.
And it, you know, it's amazing, Fred, that the communication, once you get to, you know, people ask me all the time, what's the toughest thing about practice? And what have I learned the most is it's always the communication of what we do. I mean, let's be honest with chiropractic. Our art is phenomenal. The adjusting is phenomenal. We have all the science we've ever needed. Our communication of how we talk about chiropractic,
Yes.
we shoot so low on the spectrum of how
Yes.
powerful people can be. We shoot
Yes.
so low, and we minimize how awesome you can be. We minimize it, and we do them a disservice.
Yes. Yeah.
Absolutely.
Yeah, and
Well,
ourselves,
and
you know, ourselves in the service.
well, and what, you know, when you look at the profession, what have they done? What strategy have they used to build their practice? New patients, as
Right.
opposed to PBA, right? I mean, you look at Joe, 400 PBA, right? You build your practice through PBA, not through new patients.
Correct. Correct.
Otherwise, you're
I,
just working hard.
Well, if
I,
you start it, you know, we've talked about it on this many times, but you know, start with the idea that you need to be cared for and nurtured, you know, regularly for a lifetime. Like if I'm a dentist, Tom might think I'm not trying to build a practice by filling fucking cavities. I'm doing it because I got to take care of people's teeth. You know what I mean? Like, okay, but you got a cavity because you weren't taking care of them. Not, I'm going to treat that, go out, and you know, I'll call me when you need me again. So they start, you know, with a totally different mindset. So that starts like I was saying, with our language or their communication, how we view ourselves, what our presence is, right? What our value is, what our impact is, what our purpose, mission, why is. So, hey, if my job is, hey, I need to be cared for regularly for the rest of your life, then I start my relationship that way. That doesn't mean they're all going to get there. But if I start it the other way, well, you know, I'm going to prove myself by taking care of your neck pain, and then you're going to have some fucking revelation in bed one day and wake up and go, oh, I should do this for the rest of my life. That's not what happens. They go, hey, thanks, I appreciate that. Now you further substantiated what they thought it was. You didn't talk nerve, you didn't talk organ, you didn't talk about life, you didn't talk about vitalism. They're fucking gone.
they're
They
done,
coming
and it's
back.
amazing that we are told you know, when you get outside marketing groups coming into your practice and they want to market your practice, they always shoot for the lowest fruit, which is the acute low back pain. And I'm saying 30, you know, as the studies were, well, we did a talk with somebody, a group, and they said, well, that's what we're great at. I said, what has that got in our profession? The last 50 years, we've been harping on we are the best at low backs, and we still aren't the low back specialists that are
Right.
referred to all the time. Undoubtedly,
Right.
we need to change our message.
Absolutely.
And
So
they're right to, I get that you are great at back, but then that's so like you're talking about Otto, low hanging fruit. It's limiting it. Okay, but you're also great at neck. You're also great at you know, neuroplasticity, and you know, we can measure how quick an eye can see, you know, your brain can see an image, and we can measure that it's faster after you get an adjustment. We can measure your immune system. So you're great at optimizing the nervous system. You're not great at backache. You're great at all of it. But again, it's like you said, it's communication. It's what is our premise? What's our intention? What's our objective? And then communicate around that. And that's how you end up seeing more people. They're going to stay because you offer them value for better life. They're not going to stay because once they're like, hey, thanks, you're a tool, a screwdriver. I don't need a screwdriver anymore. You know, I'll call you when I need a screwdriver. But if you're over there making a difference in their life, they're going to drive and wait and pay because, hey, when I see this guy, when I see this lady, and I see them, they're improving the quality of the rest of my life.
So Otto, where did you get your philosophy? I mean, you're obviously very seasoned, and then once you had your philosophy, how did you
Why is he obviously really seasoned? The gray in his beard.
refine your
Is that why he's
communication?
fucking really seasoned?
Right there, Fred. You know, I got into chiropractic. I used to live in Las Vegas, and and my brother, who was a PT at the time, said you should be a chiropractor. I'd never even heard the word before. And so I used to go to the library often when I lived in Las Vegas. And I went there often because of three very important reasons. One is because they could run the AC in the library all the time, and we couldn't run in our apartment all the time. Number two is I could take a nap anytime I wanted to in the library. It was very, very comfortable. And three is I could read any book and magazine I wanted to for free. And that, hey, you know, that's how you start a profession, right? But I went there and I read, I did a talk for a time ago about the sentences that have changed my life. And the one sentence, I read a book. I couldn't even tell you what the book was. I read a book that said that we are the most over-surgeried, most over-medicated country in the world. We're not the healthiest. I stopped at that and I went, son of a bitch. Yeah, we are. Yeah, we are. But it was the next line that said, everything we've ever needed to be our healthiest is already here. It's already here. We got to unleash that to its full potential. And I closed the book. I said, son of a bitch, someone else feels the same way I do. I had to squirrel back and go find that page and get the little golf pencil and a little piece of paper they used to have in libraries. I wrote down the toll-free number because we couldn't afford couldn't long distance back. I know no one knows about that. We couldn't afford long distance back in the day. So I literally ran back to my apartment and called Palmer College of Chiropractic. And I said, hi. I said, this is Otto. I'm coming to your place. Send me everything you have. They said, who's
Nice.
this? I said, it's Otto. I'm coming to your place. And they said, have you applied yet? No, I don't care about that. It was at that moment in that library, I found my gang. I found my gang. Everything else, the schooling, inconsequential. That's where I'm going to go. That's what I'm going to do. And I moved back to my hometown. I took physics, chemistry, organic chemistry, and anatomy physiology for a year. That's all I did. Then I went to Palmer, and it wasn't easy. I'm a grinder. I'm not the cat with the sharpest claws by any means. I'm not the smartest kid in the class. I'll be at the end of the game with a W on the board.
Awesome.
Yeah, very true. Great. That's awesome.
So you probably came out on
You
purpose.
got out of there, you immediately. Go ahead, Fred. Sorry.
Well, you know, I came out on purpose, but you get uneducated when you get out. When I started, so I got hired by a company. I had like 50 clinics, and I had no idea that it was just a meat grinder. And they put me in there, and they didn't want you to talk about nervous system, subluxation. It was all very much a insurance mill. And you get in there and you run the bill up as high as possible. And within a very, very short period of time, I said, this is not how I want to practice whatsoever. So I bought my way out of my contract, which was unheard at that time through them. And I moved down the street and I ended up moving up here. And I always knew my goal was to help my friends and family and my colleagues to be as healthy as possible. And again, exercise all you want, eat great food, get mental rest and focus, but we need to have that nervous system optimized.
Exactly.
I can't put great programs onto a computer that doesn't talk to itself.
Right.
And you know, I was talking with my friend Dr. Eric Plasker, and he was talking about the misdiagnosis of people. He said all of it should have some neurological basis to every diagnosis that ever comes into your office, and it's not. And so I'm gonna bring this up, Joe, is the article I wrote last year called "The Side Effects of Chiropractic." And although the person comes in with low back pain, you and I we've all, Fred, Joe, we've all seen it, that a person all of a sudden they're digesting better. Maybe they're breathing better, they're resting better, sleeping better, thinking better, moving better. All these things are happening to them. They came in for this one thing here, but all these other things are happening. How is that possibly happening? And if you deny the extensive greatness of the nervous system, you are doing a disservice to your profession, to your practice member, and your practice. And so one of the biggest words I ever think we need in chiropractic is the word "and." And it's this. Yeah, doc, you know, can you help me with my low back pain? Yes, I can. And this. So we started a couple of years ago on our rechecks. We ask our patients, what's gotten better since you started here? And what else has gotten better since you started here? And it's that, and what else has gotten better? So they tell us they're sleeping better, moving. So then we put a spreadsheet of 30, 40 things that these people tell us have gotten better. So when you come in my practice, I tell you, by the way, you know, doc, hey, can you help me with this? Well, yeah. And these are other things that people have said have gotten better also. It's the and that we are denying. It's the extensiveness. How could it be that when we adjust the atlas, and it's been shown in great research, been shown that your blood pressure doesn't get high or low, it gets optimized. While when we adjust that same atlas, your immune system gets stronger also. Great research both ways. Does the body then say, I'm going to categorize and say, only put 40% going to the blood pressure and 60% to the immune system? Or does the body say, we're going to do all of it all at one time? Well, if that's happening, then we got to be adjusting people so much more than just for back pain, neck pain, anything. We got to be adjusting them because it is the best thing for them for their life. That's the best thing. Here's the reality. Here's the reality. If it wasn't, I wouldn't tell you. I wouldn't tell you that. I'd be incapable of lying to you.
You know, and the funny thing is, it's amazing how many chiropractors don't go through all the organ systems and all the possible health problems in a consultation. You know, that's one of the things we teach, and I know you do, Joe, and Otto, obviously you go through that, where chiropractic isn't even getting the credit because people forget. I used to have heartburn every day, but now that it's gone for a month, you know, because in our re-exams, we go through all the subjective complaints. I have to put the improvement on the organ problems like what you do. And how many times, Otto or Jody, running, shit, I forgot I used to have heartburn, or I forgot I used to, my whole life I had allergies and I don't even remember that I used to have them. Or whatever it is.
Yes.
But chiropractic's not even getting the credit because you're doing a fraction of the consultation that you should be doing.
Right.
Plus, a lot of people, you know, what do they think? Like when you ask about blood pressure or whatever, and you see in a consultation, you see them look up like this and go, oh, no, I don't have that. But what are they thinking? Yeah, my MD takes care of that. No, I'm here for back pain. I'm not going to talk about it. Like as soon as you see their body language shift, okay, what were you thinking? Well, I have high blood pressure. You know, it's like you believe what they're saying rather than digging into what's their mindset, what's their belief system. And then lifestyle is a belief system. The goal is to change their belief system, not just give them information. And pay attention. pay attention to how they're moving and what they're thinking.
Yeah.
So,
You know, a short time ago, I was sitting with some students from a college that's near me, a chiropractic college that's near me, and they were talking about how they were research based. And I said, well, first of all, awesome that they were research based. And I said, well, awesome, then you must be all chiropractic biophysics just heads. I mean, you must be right on top of it, because that's the most researched technique in chiropractic by far. And they said, no, we're not. And I said, okay, here's the contradiction. You're telling
Yeah.
me that you're research-based, but you don't do the most research-based technique. No, we're not. And I said, so how do you talk about chiropractic with your patients? They said, well, we don't use the word subluxation. I said, well, why?
Jesus
I
Christ.
said, why not? And they said, well, we use fixation.
calm down, Joe. Calm down. It's okay.
Yeah, why don't use that word, Jesus.
I said, so you use the word what? Fixation. I said, fixation of what? They said, of the joint. I said, and so I'm like, okay, now I have to go through the next 20, 30 minutes of drawing two words out of their mouth.
Yeah.
And it is, so, okay, what allows that to be fixated? Does it do it by itself? Well, no, the muscles. So we're manipulating the person so the muscles work better. Okay. How do the muscles, why are they not doing the job they do? And they don't, you take that, you know, I take that pork chop, I throw it on the grill. It doesn't just start dancing by itself. It doesn't do it. It's just
Right.
a slab of meat.
Hey, can I interrupt you real quick, Otto? You know, when they said, well, we don't use the word subluxation, your body language went like this, like, oh my God, there's so much stress. Like, even just thinking about being in that moment, man, you literally, both hands went on your forehead and started rubbing your head.
And so I just tell them, sooner or later, I'm going to get the word nervous system out of you. I'm going to get the word nervous system out, get the words nervous. And once we talk about nervous system, now we're talking about a subluxation.
Right.
You may tell me you don't like the word. Okay, then find me another word, because the fixation doesn't cover it. Find me. I'll use any word you want, but it's got to tell me that the nervous system is affected by this. And so finally you get through that, and they're like, well, that's. I said, well, you got to talk to your patients. You need a new vernacular.
Yeah, exactly.
And they get scared by that.
Yeah, right. They don't,
They need a
number
new
one,
mindset.
I always tell people, there's a reason we don't adjust dead people. Like, why don't you adjust corpses? They got fixations. You know what I mean? And if you reduce a fixation with adjustment, it's going to do anything? No, because it's about life and energy and expression within the body. So, you know, like Fred, not to steal Fred's line, but I'll give you credit, Fred, right? It's not the curve, it's the cord, right? It's not the spine, it's the nervous system that's inside of it that you're caring for, that you're attending after. But yes, it's not their fault either, because they're going to school with professors and their leaders, and they're saying, don't use this word. Like, oh, this is why we're not accepted. So we're going to use all these other words. We're going to use fixation. Oh, so now you're going to be able to walk into the surgical ward and go, hey, listen, fixation. Oh, come on in, doctor. Let me, you're a real doctor now because you don't use those quacky words. Like, what the fuck? Like, are you serious?
And here's the problem, man, when you're going through school, because I went to LACC. Why did the students believe them?
Right.
You know, that's what I say. Because people go, well, you went to LACC. How'd you become so principled? Because I'm an Italian from South Philly. That automatically puts you in, you're probably lying. I don't believe anything you say.
Exactly.
Fuck you. I'm going my own route, right?
Exactly.
That automatically makes you a rebel. Like, why did you believe them?
Yeah. Well, I was on the board at Sherman for a long time, and I'll tell you don't realize how important that board of trustees is, because they're setting the compass for governance for the administration in the academia and the college. So you've got all these schools, and they're bringing in a different board, or they're bringing in the wrong people that have the wrong message. So then the academia changes, and then they're teaching all these students everything else. But I went to a 3-day sabbatical. I know you know this. This is going back years ago. I recorded it, posted on YouTube, and I went to Palmer, and the young woman, very nice lady, I said, hey, listen, she goes, what do you want to do? I want to see the research library. Like, I want to open up all the books. I want to see the little written hand. I want to touch the written hand of BJ Palmer. Like, I want to see his books. I want to see everything he wrote. Like, I want to, and it's all under lock and key. And she wanted to show me the rehab facility. Like, she wanted to show me Cybex machines. And I'm like, where's all the adjusting tables? Like, I'm in Palmer. I've never been there before. I went to National. So I'm thinking, wow, it's going to be like adjusting tables and needed chest tables all over. And, I saw the old black and white. So I'm thinking that's what it's going to be. It's a fucking physical therapy center is all it was. It was so unbelievably heart-wrenching, disappointing. I asked her, like, Fred Barge, Jim Sigafoods. She didn't even know what I'm talking about. Like, she's clueless. She knew none of these people. It's just, yeah. So that's why, that's why Chiro Mafia is important. That's why talking to guys like us that are important, that we're still in the game, pushing it. That's why people need to hear this nonstop, and the young people need to hear it, because unfortunately they've been so misguided about why they're even in school or what their job is when they get out of school that it's a re-education for sure.
Massive amounts. And so I was going to write a paper on this, and I can't write this, or I'll never be allowed back on any campus. I was going through and I was going to take all the research that they show online on their websites, and I was going to categorize it into like 5 different categories. One was going to be, back pain of some kind. One is going to be, in just the titles, do they talk about back pain? What do they talk about? Do they talk about nerve? Do they talk about subluxation? Do they talk about adjusting? Do they talk about, and then the 15 other things they talk about. And it was all the other stuff that they were talking about, instead of how we can help you to be better overall for decades to come. We need to set a foundation of how healthy you can be.
Yes.
And it's health is simple. Disease is really tough. Disease is an abnormal part of life. Yes. Health is the blueprint. Our job is to get you back onto that blueprint as much as possible. And once we start talking to our patients like that, boy, practice gets a lot easier, a lot more fun.
Yeah. And then what you said is exactly right. I mean, easier. How long does it take? I got adjusted today. So I was laying down, Dr. Burke comes in, gives me an adjustment. I'm your perfect practice member, right? I mean, you don't have to explain anything. You don't have to validate anything. You don't have to fucking prove anything. I'm in there with a greater belief than you do. Light me up, open me up, get me good, get me healthy, get me well. Boom, boom, boom. I'm out. And that's what you're trying to create. You're trying to create that mindset in the people you take care of, so that, like you're saying, Otto, it becomes easy. It's awful when you walk, oh, doc, before you touch me, let me unload all my fucking symptoms on you. I mean, I'm not going to do anything different. I'm your fucking chiropractor. You know what I mean? I mean, I'm going to come in and I'm going to adjust you. It doesn't really matter, short of a car accident or a trauma. I'm going to get in there. I'm going to look where you're subluxated. I'm going to put a thrust in you. I'm going to try to get your body to work better, get pressure off the nervous system. So in the end, that's what we do. And I also look at, I see some docs and they get frustrated and that in some way they look at what we do is limited. I see that with a lot of students and such. And I'm like, if you're a dentist, like, your dentist doesn't go home crying because somebody came in with a knee problem or plantar fasciitis and they didn't know what to fucking do. They're not like, oh my God, you know what? I was cleaning this guy's tooth and like he came in and his knee hurt and I didn't know how to do the rehab. Like, it's not what they fucking do. You know what I mean? And what do? If you're an orthodontist, you straighten teeth. Like, if you had a cavity, if I'm an orthodontist and I go, geez, Otto, your son there, I don't like the way that tooth looks. You better get him over to the general dentist. Like, that's what I'm going to do, but I'm still going to straighten out the braces. You follow me? Like, stick in your lane, stay in your lane. What you do is unbelievably valuable and important. Yeah, you're not going to rip somebody's chest open and be a cardiothoracic surgeon. If that's the validation you need in life, then go be a cardiothoracic surgeon. But in general, I mean, chiropractors are superheroes in what they do. So be proud of it, be a master at it, and grow your practice at it.
Now, obviously we coach. So what, and Reggie was great about this, right? His whole thing was, you don't have to know anything. Just move the bone, let God do the healing, right? So his answer was, well, doc, what's causing this? I don't know. Right. His answer was, I don't know, right? And doctors think because you have the title, you have to give these answers. People come in, well, I have this and I have this and I have this. Exactly. And they say, what do I say when people say that? When they say that? 3 words. Let's check you. That's it. Let's check it. Face
Yeah,
down.
exactly.
Right? 5 words. Let's check it. Face down.
I had a,
Well, I'm not looking at your face in the first place. I ain't your fucking dentist.
Yeah.
Lay down, vertebrae up. Let's
Can't
go,
give
big
you a
guy. Come on.
facial.
Jesus.
I had a, I was on someone was interviewing me on a podcast, a scientific podcast. And my first article I put out in 2019, after helping a woman, she was a practice member, left the practice because she had a double radical mastectomy with lymph nodes taken. She emails me one day and says, "I'd like to come back to the practice. Let me know what I have to do." I said, we're going to test your nervous system. So I used the substation. I used it every single day, and we tested her in HRV. And her heart rate variability is the best way to find out the adaptability of the nervous system. Hers was absolutely toast, as you would assume it would be after being beat by a shark who had brought a grizzly bear to tag team. And she was, and she was 8 months out. So I test her, and then after 44 adjustments over 6 months, we retest her, and her nervous system, her heart rate variability is back almost perfect. She couldn't exercise during that time. She couldn't really digest and eat, inability to really rest. So what was the only thing during the 8 months, the 6 months that was different? Was she was going to adjust on a regular basis. And I have to tell you that there were no articles, no classes, no books on how to adjust people post-cancer.
Right.
So what I defaulted. And people always ask me, "What'd you do?" They're like, "What'd you do?" I say, "Come here, let me tell you." I adjusted her.
Yeah.
And they go like this. They go, "What?" I adjusted her. So I couldn't do my normal sets of adjustments. So I do leg checks. I listened to what her body said or what her body gave us to know.
Yeah.
And we adjusted her. So months later, I'm published on that article with the great, the late great Dave Russell. And I'm on this podcast, and the guy says, "So this is fantastic. This is a great article. This is a fantastic article. All chiropractors should have, because this doctor we have on today, he adjusted someone post breast cancer, surgeries, chemo, radiation, and this person, as we say, she awoke. Her nervous system woke back up." Well, the research also shows that these women don't wake up for a minimum of 10 years without something happening. And their body's toasted that long. So this guy says, "Okay, great. Let's get into this. Dr. Janke, when you adjusted somebody, exactly what happened to them? What exactly happened to them?" And I said, "Couldn't really tell you." And he says, "What?" I said, "I adjusted them, they get better." I said, "I don't know the whole intricacies of the nervous system." I said, "One of the biggest things chiropractors try to do is try to become the most scientific person on the block, instead of saying, because your MD has no idea about the rainbow of drugs they're going to be
They don't
prescribing
even
you."
know how aspirin works, for fucking God's
No,
sake.
they don't
even know.
They don't know about that.
Acetaminophen works as an analgesic. They don't even know the mechanism fully.
And I said, did you have Dan Murphy on here?" He said, "Yeah, we had him on months ago." "Did you have Amy Haas?" "Yeah." "How about Dr. Mo?" "Yeah." "Why didn't you ask them? They're a lot smarter than me. You should have asked them. I don't know. They're the ones. I'm the one. I go to Murphy to find out shit I don't know. 31. I read all his books. I don't know.
You had the case study. That's why.
I had to study, man. I don't know."
You had the article.
And he was like,
"Here's what I say. I just say, listen, what's better, straight or crooked? Just ask him.
Yeah.
What's better, straight or crooked? Straighter's better. Why is crooked bad? Is there health in crooked? Do you work better crooked? Does your nervous system work better crooked? Does your immune system work better crooked? Well, no. So let's get you straighter and keep you straighter. I don't have to know all the other aspects of it, or every neural fibril, or every neurologic column of clusters of nerves. And the bottom line, they don't work better if you push on them. They work better if you take the pressure off. Get
Shortest
the pressure
pod-
off, keep it off. Hello.
shortest podcast I was ever on. Shortest one I was ever on.
Whoa.
I was like,
Come on.
I was like, no. I was like this. Let me go back to that first time I saw Murphy, and he showed how the adjustment for the 14 pages later.
You're pulling up your PowerPoint. You're pulling up your PowerPoint.
Yeah, I said, no, that wasn't even a PowerPoint.
I know I took pictures. I think it
was the plastic slides they put on top of the overhead. I think it's what he had.
Oh, Jesus, that's a long time ago.
I started started going to him in 95
Yeah.
or 97. But I said, I don't know the full,
Yeah.
nervous system pathways for that. The guy's like, I said, I don't think I need to know.
Right.
He said, I don't know. He was like, wow, that was really disappointing. I was like,
Yeah.
Well, on to our next
again,
guest.
right. Well, you know what? Like I said, the reasoning, you're choking on something and I do a Heimlich maneuver on you. Do I need to know all the neurofibrils and the exact angle of the fucking diaphragm and what rib I'm pushing? No, I mean, I put pressure, increased air in the lung field, boom, the chicken pops out, right? I mean, so you don't need to know all that for the procedure to work. So it doesn't matter.
You know, the other thing I get interested in with chiropractors is what bone is the most important nerve in the spine?
Yeah.
And I said, it's the one that's subluxated. Like, well, it's what about I said, it's if you're trying to water the garden and the water, you turn the faucet on and the water's not coming out there, do you only look at the faucet and then where the end of the hose, where the nozzle is?
Yeah.
Or do you look at all the different kinks along the way too?
Yeah, exactly.
And so that one was open to me also. It's like, well, wherever the subluxation is, that's where the kink is in the water hose. That's the most important one that day.
Yeah, exactly. Exactly.
That was interesting. Yep. I've screwed up a lot of good podcasts.
I don't know. You screwed up any of them. So that's good. I remember, did you ever see the one with Reggie and he was being interviewed? I mean, there's so many with him, but he was being interviewed and he had a medical doctor on there and they had the news broadcaster on there. And, I mean, he was great because he was deliberately, almost by his responses were deliberately there to evoke or invoke conversation. Like, well, what I do isn't therapeutic. Well, what I do, it doesn't matter. And the guy's like, his head's ready to explode because he just was all ready to go after him because he was thinking Reggie was going to come at it like from a medical treatment standpoint. And he's like, no, what I do is not therapeutic. Like, it was masterful. I mean, it's dated. Everybody's got the lamb chops and, the comb overs and everything, but it's pretty good. It was pretty good.
I was I've had a hip problem for a couple of years. So I went and got a shot in my hip yesterday.
Yeah.
And it was a really good talk I had with the orthopedic. And he said, you're a chiropractor, huh? I said, yeah, I'm right over in town, small town. It's down by the movie theater. And he says, I think about 50% of chiropractors do good jobs. And the other 50%, they want people just to keep on coming back for like business and stuff. And I'm like, man, we were having a great relationship until this point. I said, if the research showed that by giving a shot of cortisone into their hips, that everybody was going to live longer and better, wouldn't you be fucking pushing everybody to get a shot of cortisone in their hip, knowing that they're going to live a longer, healthier life? Wouldn't you? If the research showed that, wouldn't you be having a billboard up on 281 showing that? And he's like, well, and you go like, man, we need to get out of the healthcare game and get into the people caring game.
Yeah.
He said that?
I said that to him.
Oh.
We need to get out. We need to get out of the insurance game and get into the people caring game.
Yeah.
And you would think someone would have a great idea of what we do, but he had no idea.
I get that. I always say to dentists, I go, dentist, nutrition, and exercise. That's where I go. I know, I hear the same thing about these dentists. I go in, I get a clean bill of health, everything's fine. And the son of a bitch, you know what he did? He told me to come back in 6 months and he told me to brush twice a day up until I came in. Like, isn't that absurd? Like, what a ripoff. Like, that's just crap. And my trainer, he said that, listen, I got to keep working out. Like, I can't stop. If I stop, I'm going to lose it. Like, I don't know if I buy it or not. My nutritionist, he literally said, listen, Joe, you're doing great. Keep eating good every day. And I'm like, I don't know. He's up to something. He must get a percentage of that healthy food I'm buying. Like, really? I mean, come on, man. Are you that stupid? Like, come on, man.
So, Joe, why do you?
Is that what you're saying in a consultation, Joe?
Yeah, no, I don't say that in a consultation.
Are you that stupid? But that's your workshop.
But Joe, you and I have had this discussion many, many times. But why do you think people have that limit? They put that limitation upon chiropractic and not upon some other things that are just fundamental aspects of health? Why do you think that? Why do you think that's still pervasive? Why is it even allowed to be?
Is that a literal question? I have an answer.
they say with a treatment therapeutic outcome model. You're in a therapeutic outcome model. My back hurts. I came in. My back feels better. Why are you still giving him treatment if my back feels better? Because I'm not treating his back. But they still try to force you into that therapeutic treatment model with outcomes, and that's where evidence-based, right? How many adjustments, what type of technique, how much better they're doing. Like, no one does that with anything else. You don't do it with nutrition. You don't do it with brushing your teeth. You don't do it with exercise. So why are you doing it with me? Because, we take insurance and you're trying to fit us into that therapeutic model.
Well, there's
And I don't
also
fit in the therapeutic model. Your back hurts because you didn't take care of it, not because it's so-called out of alignment, right? And now being out of alignment, not because you didn't take care of it. What's happened to the nervous system? What's happened to your prostate, your large intestine, your bowel, your bladder? Like, what's happening to all those other organs and systems? The health of your legs, your veins, your arteries. Like, what keeps all that alive and functional? Your nervous system. So if your spine's crooked, it's better for you. Well, no. Well, if it's not better for you, shouldn't you get it taken care of and keep it straight and healthy? Like, doesn't that just make sense? And when you explain it that way, they're like, yeah. So, I just try to take them there everywhere I go, and I never let anyone say something without at least trying to get them to go into a different, in a loving way, but I'm trying to get them in a different direction. So,
and that's the difference between chiropractors think they're healthcare as opposed to healthcare lifestyle. Like healthcare has a result.
yeah,
Healthcare lifestyle is ongoing.
right.
You know what I mean? That's lifelong. So and it's just what you said. It's a therapeutic approach because, even when you look at CBP, they sign them up on a corrective program. And what do? They focus on changing the spine and they forget about the cord. Why did Don Harrison? I mean, he was a math teacher. He had a PhD, I think, in math and a master's in engineering. So he just had the knowledge to figure out the optimal structure, came up with a unique equation for the optimal spinal structure. But even CBP guys, they forget about the cord. They just want to fix the spine, and that has a result because they set them up on a program. Just the word program has an endpoint.
Right.
And that's the problem. Even when you use that word, a program of care will sign you up on your second program. So we eliminate that word.
That's what I have a problem. And again, I know it's put up with the right intentions, but once we label care like initial intensive, corrective, wellness, like that kills it. I've said it for years. Like initial intensive, ooh, that sounds really bad, and that it sounds expensive. And then corrective sounds less. And then wellness care, if you want, it's like Flintstone vitamin and a baby aspirin and a pat on the ass and you're good to go. You know what I mean? Like it doesn't have any value. Where my attitude is the wellness care is more valuable than the sick care. If you want to put it there, because it's the wellness care that keeps you from getting sick, right? So listen, you're going to go to the most expensive part of the care, and that's keeping you healthy. Because why'd you break? Because you weren't taking care of it. So we got to spend time and kind of waste time to get you healthy. And then once you're there, the most important part is to keep you healthy, right? So that whole division of giving a hierarchy to a different level of care hurts the profession. It hurts the whole mindset. It confuses the patient to think one part is more valuable than the other. Brushing my teeth is equally as important today as it is tomorrow. I can do the best job I've ever fucking done at brushing my teeth today. But if I don't do the same great job tomorrow, what I did today is useless. It doesn't matter. It's just crazy.
Yeah, well, so that's where, oh, sorry, Otto, go ahead.
Oh, go ahead, Fred.
No, I'm saying when you look at the phase of care, we just call it all three phases. We just call that health recovery.
Yeah,
that's really what you're doing. Health recovery phase. It's not a program. And why you need health recovery? Because every patient only has one problem. You never took care of your spine and nervous system.
Right.
And that's the only problem you're solving.
We've tried to recover what you've neglected for the last 30 years.
Right.
30 years. 30 years.
Go ahead, Fred. I'm sorry. I couldn't help myself. Exactly.
Yeah, well, again, we're in a Chiro Mafia, so all the Italians want to talk at once.
Yeah. Just so you know, if I talk loud, I'm not mad. I'm just talking. I'm bashing it. That's what Melody still says to me. God, will you stop yelling at me? I'm not yelling at you. This is not me yelling at you.
I'm just telling you, it needs more salt. It just needs more salt. That's all I'm saying.
Exactly. Seriously?
Needs more oregano. That's all I'm saying.
What are we out of sauce? I mean, honestly, you're giving me what, a couple of tablespoons over here? Jesus Christ.
Out of sauce.
Hey man, I've been married now to Molly
what do you sit down for? I'm not done eating. That's what I say. My mother never sat. She waited till everyone else ate. Then she got us into the other room, gave us dessert, and then she would sit down and eat. So when Melody serves me food, I'm like, why are you sitting down? I'm not done eating yet. What are you doing? I'm not done yet.
Wow.
I know.
Wow.
It's tough.
Wow.
It's tough.
Wow.
It's tough.
Hold on, phone call. That's Melody. That's a Melody on there right there. Oh yeah, I know.
She knows. She
Why?
shakes her head.
Why are you sitting down? What do I look? I'm done.
She
Hey,
calls
man.
my mother. You ruined him. You ruined him. What did you do to him? You ruined him.
That's about right.
That's awesome.
That's about right.
Oh, that's funny.
Cool. Anything else, gentlemen?
Yeah, well, what you had that one study you said wasn't the only study that you have like 3 or 4 case studies, don't you?
My next study is I'm presenting at IRAPS in April, May.
German?
Yeah, I'm presenting and this will be my next paper coming out, will be how chiropractic is a longevity step. And this is a big part of my practice. And we show people that when we adjust you, your nervous system gets so good, so extensive, but now we can show through heart rate variability that we can start pushing your longevity. You want to talk about health and being better for decades, don't you? You want to be able to save money? Yes. The average American couple is going to spend $315,000 in retirement on healthcare costs alone after what Medicare pays.
Yeah.
No one is ready for that. Your financial advisor has been lying to you all this time.
Right.
No one's ready for that. And I tell people, so I said, if I could show you how to double or triple your retirement monies, would be interested in that. They're like, yeah, what? Bitcoin? What do I got?
Yeah.
No,
Yeah.
get super fucking healthy.
Right.
Make sure your nervous system is optimized so you can adapt to whatever comes down the road. Make sure it's that. And therefore, you're going to need that money, those healthcare monies, not for healthcare. You could do it for fun, to go on trips, go see Joe in Italy. You could go do that.
Yeah.
And people are like, well, oh, that? What do you mean? What else is there? What else is there? And so I showed, my next paper is going to be showing that the chiropractic adjustment, we have studies, we have like 6 studies right now that show that chiropractic improves heart rate variability. Heart rate variability pushes longevity.
Right.
Yes. And the funny part about it, people are going to ask me, how does that happen? Here's my 3 my 3 words from Fred. I don't know.
Yeah.
Yeah. Exactly.
I don't know.
Well, you've got the wealth of the healthcare quotient that was done a number of years ago. That was 3,000 people, which showed people just kept getting better. And then Curtis Fedorchuk, he just did a study not too long ago. I believe it was 36,000 people, and he was showing that wellness model, right? And he was showing really the epidemiology of people under care and using the SF-36 and an evaluation to determine how healthy they were. Once you classify your health as poor or less, 70% of those people are dead within a year.
Wow.
So really powerful. So, getting them up to fair or good or higher, and then you start looking at those studies, the Curtin study where they show people that are under chiropractic care, you use $8,000 less per year for your health care. You are more financially independent. You're more independent. You live at home. You're more independent in your activities. Your social activities are higher. Like every aspect was measured higher with the group that was seeing chiropractic care. And that was a randomized study. So they just took a group of people and said, hey, do you go to chiropractor? No. Hey, do you go to chiropractor? Yes. How old are you? I'm over the age 65. Great. And they started questioning their quality of life based upon one group versus the other. So like you said, doesn't mean we don't need more research, but there's certainly enough research out there to feel 100% certain in clarity when you're talking to people and to know what you have to offer people as a better life and a longer life. It's just a matter of packaging that in a manner of communication and value that people are going to want to, utilize for the rest of their life.
We push on to people, my favorite word in chiropractic is independence.
Yeah.
And we're going to help you to be independent of medications, independent of surgeries, independent in your lifestyle, helping you stay out of hospitals, helping you stay out of nursing homes. When you start waving that flag at people over the age of 50, they pay attention very, very quickly to it. And they're going to say what I have to do. Follow my protocol.
Yeah, exactly.
Follow my protocols. Do this. And well, for how long? How long do you want to be around?
Exactly.
And that's very, and that's just a simple question. How long do you want to be around? How long do you want to play with the kids and grandkids?
Exactly.
How many more concerts do you want to go to? How many more national parks do you want to be there? How many times do you want to sit just eating some beautiful, beautiful, great food? How long do you want to do that? That's how long we're going to do it for them.
Exactly. Exactly.
Give them the option. No one ever
Right.
says, as Joe says, no one ever says, no, you son of a bitch. It's not what
Right. Well, I ask people, is this your healthcare? I hope I don't get sick. This is your plan. I hope I don't get sick. I mean, that's one way to do it. I get it. But, another way to do it is take better care of yourself.
And we have all the studies we've ever needed. The classic one is by, that came out of what was national and showed that, we decrease overall healthcare costs.
Right.
And I was told I did a talk at Life, and we had some docs from Illinois there, and they were told by Blue Cross Blue Shield of Illinois, something like that.
Yeah.
That they were not allowed. They were not allowed to use that study in any kind of public.
Correct. That was the study, the Blue Cross Blue Shield study in 1990. Absolutely. Yeah.
And they said that the docs in Illinois were not allowed to use that study.
Right.
And I said, why is that? They said if we used that, then they would quote come after us.
Right.
Said, how are you going to, it's on the internet. How are they going to do that? We're going to go off every single site and take it away. I said, the truth is the truth. When you get under chiropractic care, consistent chiropractic care, not 1-2 pops here and there. People come in to me, tell me, hey, listen, the last chiropractor I went to, he cracked me 3 times or twice and I was done. You've come to the wrong place then.
Yeah, exactly.
So I'm going to help you be as healthy as possible for the next number of decades.
Right.
Decades. I went to him twice. Well, that was 20 years ago too.
Yeah. Well, I'm here to give you a healthier life. Do you want a healthier life, or you want to die without back pain? I feel great. But I'm dead. Or do you want to live longer? What do you want? I always ask people, who lives longer? The guy that really takes good care of himself, or the guy that takes lousy care of themselves? Well, the guy that takes better care of themselves. I mean, everyone says that. Well, then let's be the guy that takes better care of themselves. Like, why are we having the conversation?
We have the blueprints. We know what to do. Do you want to do it?
Not winging it. Exactly.
You and I have talked, Joe, about helping people and giving them the opportunity to be better. And it astounds me, 31 years in practice, still astounds me this day, that they go to the MD and the MD never gives them those choices. This is what we're going to do for decades to help you to be dramatically healthier.
Yes.
That's never even talked about.
Yes.
And you want to talk about a crime in healthcare.
Yes.
It's just we're going to ameliorate your symptom today. We're not going to help you be healthier. We're going to help ameliorate your symptom.
Correct.
And I go into my MD. I had my yearly physical. The guy has no idea what to do with me. I'm healthier than he is. And he's 20 years younger than me. And you look at this and say, I go into the reception area. I'm one of 30 people in the reception area. I'm the only one with a BMI that's not, close to 50.
Right.
And I'm not the only ones on some kind of tank of some kind.
Yes.
The average American fulfills 15 prescriptions a year.
Yes.
And you start going, how is it that I'm the outlier by doing things correctly? Why is it I'm the outlier in our healthcare system? And you start going, oh, we got work to do.
Right. Well, because we're thinking we save money and it's good for the system. They don't want to save money because it's about making money. GDP, man. What other country? We look at our healthcare under our economic by how much the GDP or how much healthcare brings in the GDP. So they want that number to be high. Wow, it's trillions of dollars. Yeah, that's great. We're over here going, hey, look at man, we could cut that number down. No, what are you talking about? We're going to lose jobs. We're going to lose hospitals. We're going to lose all this. We don't want that. So we're walking in thinking, hey, we're doing a good job, which we are for the people, but we're not doing a good job for the, for the system, for the money system. So they're like, shut the fuck up. So they don't want that Blue Cross Blue Shield study out. Cutting prescription drugs by 75%, cutting over the counter by 90%. Are you kidding me? They almost had a heart attack. Like, oh my God, are you serious?
Hey, we got to wrap up here, but
all right.
And as usual, we could go on for hours. So What would you like to, man, you've done so much, you know, you want to write another book, you've contributed and spoken everywhere, and definitely a great leader out in the profession. How do people get a hold of you? How do they find your stuff? How do people connect with you?
Find me on Facebook, Otto Janke. Just find me on Facebook easiest way, or email me, Dr. Otto Janke at Gmail. Super
Cool.
simple. I answer all emails, all phone calls. Might take me a little bit to get back to you, but we answer it all. The questions most people have is, how are you able to educate your patients like you do? I said, well, I learned from Joe, quite frankly, learned from him for years. And we take that and we give people the opportunity to be healthier. Give them the opportunity. They are literally dying in your practice to want someone to say, the house is on fire. Yeah, we know the exit's that way. Come on, follow me. I know how to get out of here.
Exactly.
They're literally dying for that, and they want that. And you ask them, how many more years do you want to spend with the kids and the grandkids? Rocking, not just being okay, but actually rocking with them. And how appreciative your kids and grandkids are going to be. My parents are gone. They've been gone for 19 years. And people ask me, what would you want from that? I said, just one more good day with them. That's all I want is one more good day. I don't want cars or houses. I want one more good day. I want my mom to sit down and make that big bin of lasagna and sit down there and just sit and just talk. And I don't want, all I want from you guys is one more good day to sit down and have one more of these talks like this. That's what I want. We can't do without a nervous system that's not optimized.
Yeah, exactly.
Absolutely.
Boom.
I was going to say, what do you want to leave them with? But I think you just did.
Boom.
Hey, I'm not yelling. I'm not yelling. I just wanted more damn sauce. I'm not yelling.
Exactly.
Yeah. Okay, Joe, what you got going on, man? What do you want to leave them with?
What do we got? Hey, we got a boot camp, Boreal boot camp coming up in Fort Lauderdale, April 12th. You can register right online. It's a one-day intensive. It's absolutely fantastic. So it's highly interactive. New book, new manual. You get everything, and you get to hang out with some of the greatest chiropractors on the planet for a whole day on Friday. It's at the Hilton Fort Lauderdale Marina. It's going to be fantastic. So
awesome. We got a whole online system. I put the whole coaching system online. It's called Secrets to the 7-Figure Lifestyle Practice. And the secrets are, hey, patient education is already obsolete, man. Just giving them information, changing beliefs gets 90% of your patients living chiropractic. And that's to create a legacy, not just to build a practice. So go to Elite Coaching LLC, ask about that. We got a bunch of free stuff on there that you can use to build your practice. So, hey, make sure you share this, subscribe. We're on YouTube. Get on the YouTube channel. And Otto, thank you so much, man. Great to see you again. Thank you for contributing all that you do. And
there's a lot for everybody
as well, Joe. Yeah.
Grazie mille. Grazie mille.
See,
all right. Love you guys.
Say thank you. Ciao.
I just